Members, my name is Jarold Mendez. I am a second-year infectious disease fellow at the VA hospital, and the title of my case is "In a Conflict Between the Heart and the Brain, the Fish Was to Blame." History of present illness: this is a 78-year-old male patient with past history of aortic valve replacement, amongst others, who began to consume more fish, including salmon, prior to his presentation. He had a traumatic fall from his bed just 2 weeks prior to his admission. He had an MRI done showing no infectious processes. A week before presentation, he became disoriented and combative. The morning of his admission, he woke up with lack of appetite and generalized weakness. The patient is allergic to aspirin. He was consuming alcohol, but the quantity is unknown due to the patient's altered mental status. He traveled to Florida 1 year ago. He had a pet, one dog, who died 1 year ago. In terms of surgeries, he had a transcatheter aortic valve replacement surgery in 2017. The vaccines were up to date. Here are the list of his medications. Notice the use of pregabalin and tramadol, although he did not know how much of them he was taking because of his altered mental status. In terms of his vital signs upon presentation, vital signs were pertinent for a pulse of 125 beats per minute and respiratory rate of 25. Physical exam was pertinent for a disoriented patient who followed just simple commands, with a 3 out of 6 systolic ejection murmur at the right sternal border, and his lower extremity reflexes were diminished. Up until this point, our differential diagnosis was broad, but included sepsis, CVA, polypharmacy, substance abuse, or meningoencephalitis. The patient was started on cefepime, acyclovir, and vancomycin, but a lumbar puncture could not be performed due to the patient's combative behavior and lack of cooperation. A CT scan of the head showed in this slide revealed no pathologic finding except for cerebral atrophy. A chest X-ray was remarkable for cardiomegaly. Infectious disease services consulted, and the patient was added penicillin to his regimen. At this point, blood cultures were predominantly and preliminarily reporting gram-positive cocci in chains. A transthoracic echocardiogram was performed, which showed an oscillating vegetation measuring 0.6 centimeters in the anterior leaflet of his bioprosthetic valve, as shown in this picture. His final blood cultures grew Lactococcus Garviae with the shown sensitivities, for which the patient was de-escalated to ceftriaxone to complete 6 weeks in total. Lactococcus Garviae was first described in the 1950s in Japan's farms as a cause of disease in fishes. It was previously confused with an enterococci species due to its morphologic appearance. Later, after discovery, it has been reported as pathogen in patients who consume raw or undercooked fish, as is the case of our patient. This case is relevant as there are very few reported cases in the literature. Most of these cases have had endocarditis, as was the case of our patient, and almost all reported patients had consumed raw fish. In our patient, he consumed salmon. Affection of the prosthetic valves is also a common finding in these patients, and in almost all reported cases, there has been endocarditis predominantly affecting prosthetic valves, as was the case of our patient. This is the end of my presentation. Thank you very much for your attention, and here are my references.